Have you ever heard of Lyme disease? A question many may ask, yet few truly understand the answer. Lyme disease is an infectious disease, a silent invader that affects numerous lives globally. It's caused by a bacterium known as Borrelia, but it's not something you catch from another person. Instead, this disease is transmitted through the bite of infected black-legged ticks. These tiny creatures are the unsuspecting carriers of this potentially debilitating condition. Now that you know what Lyme disease is, let's delve into its symptoms. So what happens if someone contracts Lyme disease? This is a question that many of us might ponder upon hearing about this condition. The symptoms of Lyme disease can be quite varied and often resemble those of other illnesses, making it a bit tricky to diagnose. The early stages of the disease often present with flu-like symptoms, such as fever, fatigue, and headache. One could also experience muscle and joint aches and notice swollen lymph nodes. These symptoms typically appear within the first 3 to 30 days following the tick bite. In some cases, individuals may develop a characteristic skin rash known as erythema migrans. This rash often appears as a red expanding bullseye and can occur at the site of the tick bite. However, it's important to note that not everyone with Lyme disease gets this rash. Recognizing these symptoms early can make a world of difference. But how does one contract Lyme disease in the first place? You may be wondering how Lyme disease is contracted. Well, it all starts with a tiny creature known as the black-legged tick, sometimes referred to as the deer tick. These ticks are primarily found in grassy and heavily wooded areas, where they wait in the underbrush for an unsuspecting host to pass by. When this happens, the tick latches onto the host, burrowing its head into the skin to feed on blood. If the tick is infected with the bacteria that causes Lyme disease, it can transmit the infection to the host through its bite. It's important to note that the tick must be attached for approximately 36 to 48 hours before the bacteria can be transmitted. It's also worth mentioning that not all black-legged ticks carry the bacteria, and not all tick bites lead to Lyme disease. However, the risk is there, and it's real. Awareness is the first step in prevention. Stay vigilant and protect yourself from ticks. Let's quickly summarize what we've learned about Lyme disease. It's a tick-borne illness with symptoms like fatigue, fever, and skin rash. It's contracted when a black-legged tick bites you. Now, prevention is simple and practical. Use insect repellent when heading outdoors, perform regular tick checks on your body, and shower soon after returning indoors. This reduces the risk of a tick attaching and transmitting the disease. Remember, early detection is key in treating Lyme disease. Stay safe and keep exploring the great outdoors.